Hello everyone, I am Dr. Sapkal here. The topic for discussion today is Prostaglandin F2 alpha. Commercially, it is available with the name injection prostaglandin or injection carboprost. It is a 15-methyl analog of prostaglandin F2 alpha. 250 microgram is the dose. It is used intramuscularly, can be used intramyometrial also. The dose can be repeated every half hourly in cases of PPH or abortion purpose. Maximum dose is 2 mg. It has to be stored in the refrigerator and it is a costly medicine. It is one of the uterotonics and it has got direct effect on the uterus. It causes strong uterine contractions. Thus, it is a drug of choice for the PPH cases which are resistant to oxytocin or Vithergine. As such, prostaglandin E2 and F2 alpha is synthesized in the residue in pregnancy and labor. Activating factors for stimulation of prostaglandin synthesis are estrogen from the placenta, oxytocin, cytokines, platelet activating factors, and endothelin 1. Decidua is the natural source for PGF2 alpha. Separation of membranes, they cause release of prostaglandin F2 alpha in labor. Thus, it is practiced method of induction of labor. In pregnancy, the amount of prostaglandin F2 alpha which is synthesized is 50 picogram per gram tissue of the myometrium per minute, and in labor it is 100 picogram per gram tissue per minute. So the quantity differs in pregnancy and in labor. Prostaglandins, they induce effective uterine contractions by increasing the myosin light chain kinase activity and by increasing the intracellular calcium. Prostaglandins also increase the number of gap junctions in the muscle fibers of the cervix and the uterus, thus cause ripening of the cervix and initiation of uterine contractions. As such, the number of gap junctions, they increase at term and disappear within 24 hours after delivery in the uterus. The gap junctions help to transfer the electric current and the metabolites in the cells. Prostaglandin E2 and F2 alpha, both along with the estrogen, they increase the number of gap junctions in between the adjacent muscle cells of the myometrium. Prostaglandin F2 alpha also increase the number of oxytocin receptors in the myometrium, and prostaglandins, they also cause ripening of the cervix by increasing one of the constituents of glycosaminoglycan in the cervix and its activity also. What are the uses of this prostaglandin F2 alpha or injection carboprost? It is used as a active management of third stage of labor for prevention of PPH. 1 ml is given, means 250 microgram intramuscular within 1 to 3 minutes after delivery of the placenta. If there is during cesarean section can be given directly into the uterus or intramyometrial injection is practiced. For treatment of atonic PPH, injection carboprost is given. The dose is same, 250 microgram intramuscular or intramyometrial, but can be repeated after half an hour or 1 hourly. Maximum 6 doses can be given. Prostaglandin F2 alpha is also used for second trimester MTP or abortion cases where 4 hourly dose is repeated. 250 microgram intramuscular, maximum 7 doses can be given in these cases. It also helps and used for the ripening of the cervix prior to the suction evacuation. But remember, prostaglandin F2 alpha is not used for induction of labor either in preterm or full-term pregnancy. One of the other use and rare use of prostaglandin F2 alpha is in cases of SAM or surgically administered medical management of ectopic pregnancy. So here is the ectopic pregnancy under sonography guidance or along with laparoscopy. The drug can be injected directly into the SAM. Criteria for SAM in ectopic pregnancy are beta HCG level should be less than 2000 milli-international unit per ml. This gestational sac should be small, less than 3 cm, and even fetal heart sound should not be seen on transvaginal sonography in the embryo. Patient should have normal KFT and LFT also. This SAM treatment is effective in 95% of cases where the criteria are fulfilled and tubal patency is observed in the postoperative period in 90% of the cases. Thus, it is one of the method of conservative management of ectopic pregnancy. In all these cases, follow-up is done by estimating the beta HCG levels. If the beta HCG level fall below 15%, means there is complete resolution of this ectopic pregnancy. But if fall is up to 40% only, then it is an incomplete resolution of the pregnancy. Other drugs which are practiced for SAM are PGE2F2 alpha, injection methotrexate, mifepristone RU486, actinomycin D, injection vasopressin and injection KCL. What are the side effects of this carboprost injection? There is a risk of intense bronchospasm. Hence, it is contraindicated in bronchial asthma. This bronchospasm is commonly observed with the prostaglandin F2 alpha. There is a risk of flashes and fever. It also increases the motility of the bowel. Hence, diarrhea may be seen when it is used in multiple doses. There is a risk of amniotic fluid embolism. Then other risks are hyperstimulation of the uterus and rupture of uterus. Hence, it is not practiced for induction of labor. Tachycardia and hypertension. Hypertension is one of the issue with the carboprost. Remember, PGE2 causes hypotension and PGF2 alpha causes hypertension. Hence, PGE2 is contraindicated in hypovolemic shock because PGE2 has got vasodilation effect. PGF2 alpha causes hypertension. It is a vasoconstrictor. Contraindications for the use of prostaglandin. Of course, bronchial asthma is absolute contraindication. Hypersensitivity to the compound means allergic reactions. Active cardiac disease or presence of pulmonary disease is also one of the contraindications for the use of carboprost. Renal diseases, liver disease. This, in cases of hypotension, this PGE2 is contraindicated, not F2. Thanks for watching.